As uh, as Lindsay mentioned, I'm John Doney. I'm the president of the Society for Total Worker Health. It's been a privilege to serve the board of the society over the past year as first the president-elect, the position Heidi now occupies, and now this year as the president. Have a long history with the society and with the total worker health movement in general, dating back to more or less its inception. And I'm just really honored and humbled to be in this role for you all today. Um, I think back about last year when we held a similar town hall about this time of year and the scarcity of information. We were just sort of talking before before we started on, where we were last year, scrambling for everything, and things are a bit better known now, and we hope to provide a clearer picture of that, but also a lot of unknowns out there still. So that's a little bit about me, Heidi. I'd love for you to go ahead and introduce yourself, and then I'll roll on to our objectives and what we're going to do today.
Thank you, John, and thank you, Lindsay, and thank you all for being here today. And as John and Lindsay mentioned, I'm Heidi Hudson, President-elect for the Society for Total Worker Health. And in my professional role, I'm a commissioned officer assigned to CDC NIOSH, working in occupational safety and health prevention. I'm looking forward to what you all say today. What brings us together through this society is a shared belief that protecting workers and advancing their overall well-being go hand in hand. And total worker health reflects a systems perspective, one that recognizes environments, policies, and practices that shape people's lives and work and beyond. So we're coming together at a time of change and uncertainty, and moments like this highlight the importance of the society and our community. And our purpose today is to ensure our members have a clear fact-based information and to hear directly from practitioners about how these developments may affect your work and how to create a space for thoughtful dialogue and grounded in our shared commitment for worker well-being. And I encourage you to engage thoughtfully, to share your perspectives and ask questions and contribute your experience, and your voices help strengthen this community and inform us how we move forward. So our commitment to worker well-being is enduring, and I look forward to a thoughtful and constructive conversation today.
Thanks so much, Heidi. I think that sums it up really well and flows right into what our objectives are for the day. So, as we noted, a lot going on in the landscape, both on the federal side and on the state side, a lot of implications, both on the direct things and the indirect things that are out there for OSH professionals, for industrial hygienists, for public health workers, all the folks who comprise our tent of total worker health. And we want to, give you all a collaborative space to share concerns and ideas. And I think about last year again, and really that was a session where we were able to get out a lot of questions, a lot of angst, a lot of uncertainty. So certainly the society wants to provide that platform for you all to share what you're thinking, feeling, and hearing as well. And at the end of this, maybe dig a little deeper into some unified strategies and things we can do collectively to have a bigger voice and a bigger impact. So we'll structure that over the agenda you see here. The first bit of this meeting will be a bit more receive oriented, and I'm going to share some of the updates we see on the federal and state side. I see that Larry Sloan was on the call, is on the call here. He's going to get a preview of a similar discussion we're going to have with AIHA members later this week. So a lot of folks in our positions are thinking about these things right now because we're setting the tone for where the rest of the year goes. After I provide a little bit of that update, though, I'd like to open the space up to both Heidi and the rest of the board that's here and the members here to talk about what you're seeing, how it's reflecting for you, and where your concerns are. Then we'll do a little bit of a discussion on how we can enhance our advocacy and our approach to policy and engagement. And I'll share some things that I've learned over the years and that we may want to consider going forward with. And then the last half hour really is just an open space. Doesn't have to necessarily be directly regulatory or legislative or government affairs related, but anything else you'd like to have us talk about or talk about with us, we've got that space preserved and open, so we'll use it for what we need. And then we'll wrap up with a few next steps and actions you can expect from us. So that's our plan for today, and I'll get us going right into it from here. So we kind of talked about this already, so I won't belabor it. But we've introduced Heidi. Others can feel free to check in the chat and share anything they're thinking up front. Feel free to use that Q&A and that chat box for questions. Any reactions you'd like, any quick resources you'd like to share. That's all great. We'll compile all that. we'll be taking any of your questions, certainly that we can, but we'll prioritize the ones that are most concrete and focused on action, if we have a lot. And we want to remain constructive. I know, we all sort of have to deal with the political valence of all this stuff all day, every day. But this is not a space for necessarily for that. It's a space for getting on with it and being constructive. So that's what we'll aim our focus at today, to the extent we can. Any first thoughts, questions, comments before I get rolling into it? All right, then I'll try to boil this down into as tight of a time frame as I can. Obviously, there's a lot taking place at the federal level that affects worker safety and health and total worker health. There's an awful lot more at the state level, to the point where it's very difficult for probably any one organization or person to track all of this at once. But I think from an angle of what's most important to us as a group of practitioners and where we can place our efforts and respond impactfully, that's sort of where I've tried to give us this look. We could spend a lot of time playing whack-a-mole with different things we could respond to. And the nature of last year was sort of receiving so much on blast all the time that we almost were paralyzed in what to do. So I think hopefully we've got a better picture of where our effectiveness lenses are and what we should truly be paying attention to amidst all the noise and chaos. So I wanted to start with just a recap of where we landed from 25 and the budget conversations and heading into our stance for 26. Of course, knowing that there are even now potential shutdown issues and that may be a continuing, consideration over the next several months. At least for the moment, what we have is displayed here, which is basically that OSHA, NIOSH, MSHA, the OSH Review Commission, and the CSB have all been funded for more or less their previous budget lines from FY24 and whatever you want to consider FY25's continuing budget situation. But the more or less the full budgets are still there. I think that with each of these, you can see the various watch issues, and I'll go a little deeper into OSHA and NIOSH in particular here in a moment. But it's not necessarily about the budget line so much as how the work and the priorities can be accomplished or reignited in the case of NIOSH in terms of things that may need to be rebuilt. For the other three agencies, the issues are a bit different. MSHA is sort of moving down a deregulatory road. OSHRC may have a budget, but doesn't have a quorum for adjudicating issues. And CSB has more or less continued to work in an unfettered capacity, but uh, its placement as a independent agency leaves it pretty vulnerable to potentially being shuttered in the current stance. So there's a lot of issues to watch for here, even with the budgets being in place as they notionally are. So in terms of where that goes from here, just laying out the pictures, we've got the full year appropriations enacted. The near-term uncertainties are at least dialed down for the moment. So I think the question for us from a society perspective shifts from shutdown risk, although again, that's out there every day, to how the agencies are rebuilding and allocating within those top lines. And we're already, on the next part of this road, as hard as it is to believe. The president's budget request for FY27 is going to be rolled out on the 17th of March. So we're moving right from one budget conversation straight into the next cycle of, what that marker is going to be and where that's going to force conversation. I think what we know at this point is, regardless of what the president's budget looked like this year, after much wrangling, Congress got to a place where they more or less passed a standard budget continuation, with the exception of things that are outside of the direct domain of OSH, I guess I would say. But that's going to be the rub that's going to hold up the budget every year for us. So I expect a lot of wrangling next year as well. What we're paying attention to as a board and what I'm paying attention to personally in my capacity and other roles is just looking at, the reallocation money, the enforcement and research capacity out of NIOSH, what's transpiring at a committee level from the budget conversation, signaling where our battles might be, and the often encountered case where the bills that get introduced then get riders and things that cross-cut and start to create complications that we need to look for. So that's where our focus is going to be on the funding and budget side. More specifically, looking at OSHA, a few things that I want to call our attention to, and some things that we'll be looking at as a board, as we navigate this year. Over the summer, there was a big push on the deregulatory package, 20 some different pieces that looked at everything from specific chemical standards to respiratory protection to the general duty clause. And that's sort of the big, focus that's kind of taking place in the background against all the ongoing work that OSHA would typically be doing. That public comment phase is closed, and the shutdown having recently restarted, the government, we're just getting back to OSHA, even looking at those comments and starting to engage with them. So I think the question here is, will we see a response and significant action on that within this fiscal year? Is there going to be any redirection of priorities from OSHA when it comes to existing programs, existing, focus areas at a regional level, so on and so forth. So continuing to monitor that. Um, from a society perspective, again, really what the key upshots here will be for us are what are the practical impacts in the field of any deregulatory package? Mostly, to what degree are things that were previously standardized or regulated going to be pushed to voluntary, pieces that we now need to monitor as professionals in the field? What convince our organizations to take on? How do we play that against what may or may not be coming out of NIOSH or other agencies? And where is the real attention going to need to be placed in terms of worker protection? So that's always the issue that we're focused on, but it's we have to get to it from a pretty complex place here. Another major issue taking place within OSHA this year, or we would anticipate taking place within OSHA this year, is movement on the federal heat stress standard. It's sort of in the late stage. There were public hearings that took place over the summer last year. There was a post-hearing submission process that's closed out, and so now, much like with the deregulatory package, there's internal work taking place inside OSHA on moving toward a final rule or not, whether that looks like what was proposed or whether that looks like it's been renegotiated based on stakeholder commentary. So we'll be looking at, from a society perspective, what comes out the other end of that, what's in the plan, what that leaves for us in terms of response, and how we want to create a posture based on that. And then, as I'll mention on the state side, I think we're tipping into maybe double-digit number of either enacted, progressed to some degree, or introduced heat stress standards at a state level. So there's a lot of different corner cases, edge cases, things that look that we'll need to mirror up to. I would recommend, AIJ puts out great policy documents on these issues. One of them, my organization helped write earlier this year on thermal stress, has a great look at where the state positions on that are in a really deep way. So feel free to tune over to AIJ for a really good resource on that front. A lot of other good materials there if you'd like. So much else going on within OSHA, but just in terms of the what we can reasonably respond to and look at from a top line, I think those are the two big things. There's the healthcare workplace violence standard. There's enforcement officer posture. There's everything else, but I think for us that's probably the best place to start and focus. Turning over the page to NIOSH, and I will fully admit, that I probably don't know as much about what's happening in the doors of NIOSH as some of the people who are on this call and actually inside those doors. I've offered sort of a brief reflection on what we saw last year and where things stand from what I know. I've heard and talked to a lot of folks in the past month or two, and I'm not trying to presume anything for NIOSH, mostly just offer up a perspective for us that can help. You see the timeline here from April to January of this, last year and this year. It feels like it was already a year ago. It was actually about 40 days ago that the UNRIF took place in January. And so, I think more generally speaking, NIOSH is, restarting and reconstituting capacity. The reporting was that we had a good chunk of folks retire, resign, transfer, take other work during that disruption period. Not everybody is available to come back right in, and even if they are, there's lots of things that take time in that process. So I think that the near-term operational reality is going to be making sure that the core functions are continuing to run, and we begin to architecture up all the things around it. I'll be on a webinar with Dr. Howard next month, and I'll be hopefully seeing him a month or two after that. And I hope to have more information for everybody as we go forward. I think we all know the confirmed programs. A lot of these were in place as of last year, so not a lot of new updates here. We also know there were some ongoing disruptions, particularly for our purposes, on the extramural coordination, training grants, other grants. So we know that the reinstatement includes that funding and the resourcing for that. Anticipating there's going to be some stagger on that, going into the cycle, but we've got until September for that renewal process. So hopefully that will smooth out and be looking relatively seamless for those it affects in the coming year. And obviously the 27 budget will tell the tale on what we're going to have to deal with from there. Just for my own sanity, I kind of put this together because I've been asked this a lot, and I was kind of wondering what this might look like. So my own projection, is it's going to take this first couple months for us to get the lights turned back on fully. Over at NIOSH, I would anticipate over the next half year, we're sort of getting back to a baseline posture. Maybe over the next year to year and a half, we're rebuilding the capacity and the staffing. And with fingers crossed, and the advocacy work that we'll do and other organizations will do, getting a full budget for 27 for NIOSH should be done hopefully early and easier than last year, and that will allow the continuity there to go forward. But even with the reinstatement, as I see here on the assumption side, it takes time to backfill. The OPM actually has a figure out there on the federal time to hire averages, which is right now it's 101 days. It's the target for it is 80 days. So we know that takes time, especially for highly technical, positions like we're looking for within NIOSH. And, we know that the extramural and research piece, that's a multi-month cycle. There's lots of stakeholder coordination. That's going to take some time to kind of get us back in the cadence we'd like. So, again, I'll once we get to the kind of discussion portion, I'm happy to open up the stage to anyone who might be able to say anything more than I can, or may not be able to, but could just let us know things are moving, and that'd be great. So that's kind of a look at the agencies. And before I turn over to some of the impact discussion, I'd like to give us a tour through some of the things that are happening on the legislative side as well. So I didn't go into detail on each of these bills for our own time and sanity here. But certainly if you have any questions on these, feel free to shoot a note to me after. There's a number of key bills out there on the Fed side that are mostly retained from last year's legislative session, 2-year session. So we've got a 2-year window for these to pass or fail. One I didn't list on here is a VPP formalization bill that's not super relevant necessarily to total worker health, but is certainly a supporting component. So know that that's out here too. But of the more direct ones, a number related to heat and heat stress and fatality at the federal level, smoke and wildfire, and then a bit of a broader Worker Protection Act that's in the House. All of these are basically sitting in committee right now. Some have been sitting in committee for various lengths of time. Some of it were introduced more recently than others. Essentially, this year is the year where if anything that was proposed is going to be acted on, it has to happen this year. So if we're not seeing a huge amount of movement in committees for these bills, we can assume they're more or less dead. But you never know for sure, and some things get some revival toward the end of a session. So these are some of the key ones we'll be monitoring from a total worker health perspective at the federal level. And then at the state level, this is just a picture of, this is actually out of date already because I know more of these are open now, but a picture of the state legislatures that are currently in session. Most of them are already. A lot of these will be closed by early spring. A few of them are year round. Some of them are not scheduled to even meet this year. Texas and Montana, I think, only meet in odd numbered years. So the number of different things that occur here year to year. I monitor the cycle and I pass down some of that information for the society too, because it's relevant for all of us. But you can see in the lower right there, my organization actually tracks all this stuff on a state side. So if you're ever interested in anything or you see anything that you got a question on at a state level, feel free to reach out. I'm happy to give you an opinion or information on it if I can. But we try to kind of, for the society, try to take a look at what are the most relevant things happening state to state that might impact us or give us some opportunities. So a few that I wanted to just call out for us from a big trends perspective, heat protection, gosh, I mean, it's just everywhere now. We've got lots of bills out there, even bills in states that are not traditionally affected by, major heat cycles. But I think, from our perspective, when it comes to total worker health and externalities, we have a lot to say there. A lot of sector-specific work, particularly in high-risk industry or not necessarily high risk, but high injury industry, like warehousing, meat and food, stone fabrication, silicosis type stuff in California. There's also a fair number of system changes. A lot of the common yearly chatter on, whether it will be state plan, Fed plan, what are the standards going to be, what are the penalties, changes to workers' comp rates. But some are pretty material and interesting. And one trend that is popping up in more progressive legislatures is looking at mental health and PTSD as compensable from a workers' comp perspective and for professionals who can diagnose issues in those sectors to be able to serve in, workers' comp capacities for diagnosing. So some really interesting avenues for us when it comes to total worker health messaging that we haven't seen in the past, perhaps. So I'll continue to watch on behalf of the society for, for those opportunities. And when we get to some of our discussion on how to maybe have a bigger voice on the advocacy side, we can talk about where we want to go with some of those things. A few bills I'll just call out for us to take a look at and pay attention to. And I'm paying particular focus on a couple states I'm focused on for other reasons too. I do a lot in California, and we're doing more and more in New York and Pennsylvania, which are very active legislatively. One is stone slab fabrication and silicosis, SB 20. Another is face coverings, which is 596 in Cal. And then in New York, there's the heat stress piece is listed there. And then, Pennsylvania's heat stress one as well. There are dozens of others, as I mentioned, so happy to take on conversation on those as we go forward. So with that, I know that's a lot. And I know, we'll have all these available for you after, so feel free to ask questions as you go. But I really wanted to talk, this is meant not to just be us telling you what's going on in the world of Fed and state policy and agencies and legislation, but what you're seeing and feeling and hearing in the field. So, really curious as to, what you're experiencing, how those stories reflect for you, where your gaps might be, what's a trending issue in your sector from a total worker health perspective that you're engaged in, and what might help you from our perspective as we hold our future events, as we go into listening sessions and engagement, as we work with others in the field on a board level. What could we do for you? Where could we show up? Where would you like us to know more? So that's sort of what I wanted to bring us into. And Heidi, I'll invite you to maybe start with anything you'd like to share or reflect on. And it doesn't have to be anything particular, but while the group's sort of getting warmed up here, if there's anything you wanted to share, and then for the group, please feel free, come on camera, raise your hand, drop in the chat, anything we'd like to share on anything you've heard.
Great. Thank you, John. Those were very thorough and very important updates. And I appreciate your broad interpretation of what is happening in the policy, budget, legal landscape. It's clear that there are significant transitions underway at both the federal and state levels, and that uncertainty can create real questions for our community. And what I would emphasize is that while the organizational structures, budgets, and priorities may shift over time, that our core responsibility is to protect workers, and that does not change. And that the fundamentals of occupational safety and health, hazard recognition, effective controls, training, prevention remain constant. And in periods of transition, clarity and professionalism matter even more, and staying grounded in evidence, focusing on what is within our control, and supporting one another as a professional community is critical. And I think the most one pathway is to translate what we're hearing about these changes into practical questions. As you mentioned, John, what does this mean for our workplaces? What does this mean to you all? Where do practitioners need support? And how do we maintain continuity in protecting workers? And that's where I'd like to hear also from the group today. Thank you.
Thank you, Heidi. And yeah, I mean, I agree. Just to make it a bit practical from my perspective, I've spent the past year talking to a lot of folks, both within the society and folks at various levels of leadership and execution in safety and health teams across the country. And I think that we are all collectively under a lot of strain. I think that the resourcing is, has gone nowhere but down from where we probably hope it would go. And I know that a lot of us struggle with how to continue to do not only the day to day, but some of the things that can often be seen as high-hanging fruit from our leadership, from a safety and health perspective, and from a total worker health perspective in particular, when it comes to mental health, psychosocial risk and harm, psychological safety, health and well-being. So yeah, would love to turn the floor over to the group. If there's anything you'd like to share, have us consider, vent, ask for feedback on. The floor is really open to you on anything you'd like to talk about on that front. And if we all just need a breather, I will totally understand that too. One of the things that I've reflected on is how much that background intensity is just constantly on for all of us. And when we were at this meeting last year, someone asked me a really insightful question, which was, how everything's happening so fast every day, everything's being thrown at the wall. Um, how are we able to respond to even one of these things, let alone to all of them? And, that was a question that knocked me over because it was so true, and I hadn't thought about it much yet at that time. And my answer was we've got to we take a step back and we've got to be strategic. We have to marshal our resources and do this in a way that is impactful because by design we're being forced to scramble in 100 different directions and we're being left with nothing much to hang on to day day that's certain. And that's the landscape we have to exist in. So we can't go chase the issue of the day. We have to stick to our priorities and our goals and come at this ready to fight. So I think that's still true. The landscape's a bit more clear this year in terms of where we can place our efforts, but it's an ongoing battle for a lot of us. And I don't, if folks want, to not reflect on the things that are rough for them today, I would not think amiss of it. But Larry, it seems like you got your hand raised, so feel free to jump in with thought if you'd like.
Yeah, good job, John. And I know you're going to be doing a GR Town Hall for AIHA tomorrow, so I got a nice preview. I just want to remind everybody that, thanks to everybody's efforts over the last 10 months, we did get the NIOSH workers back on the job, and it was a very, very difficult period of time for all of us. And I want to remind everybody that AIHA will continue to host a grassroots advocacy campaign. We're calling it Preserve NIOSH. It used to be called Restore NIOSH, and now we're into a Preserve NIOSH phase. And I say that because I think we learned a very, very tough lesson that most people here in Washington don't know what NIOSH is. And you all have amazing stories, personal stories, how the agency has supported you, either through academics, through scholarships, through grants, or on the job. And I want to make sure that the profession is aware of the fact that we've got to, every month of the year, regardless of who's in control of Congress, tell our stories and remind everybody who's in Congress how important NIOSH is as an organization, as an agency. So I just want to just direct everybody to, and I'll put the link in the chat box. The Grassroots Advocacy Campaign is open to anybody. You don't have to be a member. We've got a lot of great resources. We've got a template letter, and anybody can dial in and they can leverage those resources whenever they want.
Thanks, Larry. And hats off to AIJ on the work they've done along with us and other associations who have helped to get that message across. And that leadership is super appreciated. I think learning from what some of your members did gave us some opportunities with the society to replicate some of that and have a stronger voice. So I'm excited about that opportunity. I'd also say, and David, I see you got your hand raised. I want to bring you in here. And you've been a great voice in this realm too, is that, as a society for total worker health, we're included in that group, right? We are workers. We are folks who need these protections too. And in a rough year where we've had a lot to do and a lot on us, and in a rough 5 years where we've had a lot to do and a lot on us, we need to have this space and preserve ourselves too. And it's about our health and our well-being as well. And this is a space for that as much as it's a space for helping us with our teams and our workforces. So just wanted to note that as well as, in the broad scheme of things and advocacy, taking time out for ourselves and making sure we're okay is also a big part of the puzzle. So David, sorry, I'll throw it over to you.
No problem. Thanks, John. Hi, everyone. David Shapiro, he, him pronouns, current treasurer of the Society for Total Worker Health. Thanks for hosting this meeting. I'm going to shift gears a little bit. I'm tired of talking about advocacy and the response that we've all had to it, to be quite honest with you. I can appreciate the hard work that's gone in, and I really give you a lot of credit and gratitude to the people that keep up the fight. I'm wondering where the opportunity for recognition amongst industry professionals that are doing a good job on total worker health already exists, and how we might be able to raise the tide of all boats by acknowledging, highlighting our industry partners that are already significantly committed to worker health and safety, regardless of anything that happens at the federal level. I'm always looking for opportunities to do things differently. And so I'm just curious if other organizations are recognizing industry partners and businesses directly. I know at one point there were some federal awards like the COOP Award for worker safety, but is there an opportunity either at a local or a national level for us to simply acknowledge and recognize companies for a job well done in the effort to get more companies to want to do like the ones that are already very strongly committed to total worker health?
Yeah, I'll throw the floor open to the audience here for reaction. I have some thoughts. I think that's a great topic, David. But I don't want to impose anything before folks get a chance to jump in. Well, hearing no immediate thoughts, I guess I'll say, David, I mean, I think flipping the dial from, tilting at the windmill to acknowledging where things are working and keeping people front and center and acknowledging the good work where it happens and spurring things on that way is always a good thing. And I personally have a long history in running award programs for both organizations and individuals that is designed exactly with that motivation. And it's so important. And there's less and less of it that is meaningful and material these days. I think the number of awards proliferates, but the number of meaningful recognitions doesn't always, right? And I think that's what you're talking about, is something that is material and substantive and meant to both enhance our practice and award the hard work and effort that goes into sustaining these things. And I think it's definitely within the society's mission to take on work of that nature. So I would love to keep working that idea and see if we can bring that into maybe align with the upcoming events and things that we do, as well as just have a funnel by which to create best practice examples and ideas, and have people share their work. And getting companies involved, getting industry partners involved is a great way to sustain too. Any other thoughts from the group on that? And Manny, I see your note there that you've got a lifestyle medicine in the workplace toolkit, which is a joint effort there with. So that's great. Yeah, any place where we can have our voice and our perspective represented in partnership, I think that's a really significant avenue too. We there's so many easy lanes to pursue, I think, on the growth side for our visibility, that are a lot easier than probably getting letters read by congressional staffers. So, Jeannie, go ahead.
Yeah, hi. I'm Jeannie Nigam. I am new to joining the society meetings, and I know we've talked a lot about advocacy, but I just want to say thank you to everyone who did so much work on behalf of restoring and continuing to promote NIOSH. I am a research psychologist here at NIOSH, and I've been involved with the Total Worker Health Program since its inception. I just wanted to provide a comment in response to the idea of awards for companies that are doing a great job. We've always thought that would be something really exciting and wonderful to do. It's hard to quantify what makes a workplace, a really good one, because there are always some things that they may be doing really well and some things that they may have struggles with. So there are challenges around that, but I wanted to mention that the American Psychological Association used to do an award for healthy, psychologically healthy workplaces. That's no longer in place, but I just did a quick search and I did see, and I'm not sure if this was mentioned because I was kind of typing as I was going. There's a Global Healthy Workplace.org awards. And if that, that I just wanted to mention that. I can put that link in the chat, but I think that, celebrating what companies are doing well is a fantastic idea as a way to promote good business practices and moving the needle forward and meaningful organizational changes at the organizational level that can promote health and safety. And our program here has done highlighted companies that are doing well in the Total Worker Health newsletter over time, and those issues are archived on our website as well. So there are some good examples, at least maybe not an award per se, but a promotion of a company that's doing a really good job. So
Yeah, I love that too, and anything you can share or you see on that front is
mhm.
helpful, so please feed it along. I think it's, at the board level, we'll have a conversation at our next meeting, most
Mhm.
likely, and Monty, we can talk about this, but would love to just, we may spin this off to a committee or a group of people to work on or think about, but I think it's a great concept to build from. And the very
Mhm.
first, thing that I did back in the day when I transitioned from field work to working at an NGO was basically grow an award program from a best practice capture intended to more or less produce case studies into something that was a bit more comprehensive and able to fulfill some other objectives more broadly. And I think
Mhm.
that if we could find a partner organization or two, or an industry partner who's really doing good work here and cares about it and is willing to put some effort toward it or some seed funding toward it, we could very much have a go at something in that direction. And that
Mhm.
aligns with where I was looking to go this year as the president of the board and think about our partnerships with industry and potential sponsors and engagement at a corporate level, in addition to the work we do at a practitioner level. So love all of that. Any other thoughts or comments? I see there's some chat in here, in the chat here, which we'll capture. And I see, looking at potential NIOSH resources and things that might help. And I will say, Christina, our immediate past president, is going to be meeting with the new director of the Total Worker Health Program, as well as Dr. Howard, in the next couple days. So that is certainly something that we will be talking about more generally. Yeah, certainly. There's existing evaluation programs. I would love to work from what we already acknowledge as where we should be from a total worker health program or intervention perspective. More to come. I think, yeah, there's lots of, we don't need to reinvent wheels, right? There's a lot of good, the way to activate a lot of good research that has been done already in the total worker health space by coming to some consensus mapping. Any other comments on regulation, legislation, advocacy engagement, non-advocacy engagement, awards, recognition? Thanks to everybody who's pitched in here. Yeah, Moni, go ahead.
Hi, everyone. I thought I should jump in. I think this is really great. I think we're all kind of suffering from uncertainty. As you've mentioned, we're not, it's been a hell of a year and lots of ups and downs. What I have seen, which has been amazing, is a coming together of occupational environmental health and safety associations, including, with AIHA and Larry Sloan. Your work has been really amazing to get people involved. And I see that as something that's, sort of the silver lining of this last year. So the Society for Total Worker Health as well has been doing a great job of reaching out and communicating with everyone. I guess my thoughts, go as part of our Healthy Work campaign to how do we communicate this idea of worker protection in a more consistent way. We have the Total Worker Health umbrella, which for now we're not seeing a lot of communication coming out of NIOSH. And, I am, like all of us, probably concerned about that. But, one of the things that we've been doing, not with the Healthy Work campaign, but with this alliance that we've been putting together, and some of you on this call have joined that alliance because we're particularly interested in the issues around mental health and especially psychosocial stress, psychosocial hazards and assessment and risk reduction in those areas, is to try to come up with a coherent in a consensus approach to this topic. We do have so many different possible, various award programs, other kinds of things. I really think it would be great if we could use this time as a community to come together on, at least the issue of mental health and psychosocial hazard. So that's something that we've been working at and trying to also collaborate with the society and SOHP, AIHA as well. So, I would love it if we could try to come together around some issues around mental health in the workplace. We know that this is not going to happen probably through NIOSH or OSHA, but possibly if through a national guideline or some kind of document that brings together our very disparate approaches towards these issues of workplace mental health.
So Marnie, I fully agree with that, and that's something that I've been from a personal passion perspective really looking to see move forward over the past 15 years too. And it frustrates me to be some of these things we talked about 15 years ago. Here we are again.
Yes.
Feels like we haven't moved much. But let me, in that realm, I don't want to be too self-serving here, but my organization, What Works, on the non-total worker health side, we have a learning community called the Human-Centric Learning Community. We're operationalized around different topics or regions or industries, and we create learning communities on the ones that we think merit them. The Human-Centric Learning Community is the confluence of SIF theory, HOP, total worker health, mental health, psychosocial risk, psychological safety, all of those elements that I personally believe need to be examined in a more holistic, integrated way in order to move the needle. And one of the 3 projects we're working on within that is a crosswalk of those issues and their maturity and where they align with standards and existing rubrics and frameworks in order to help industry better operationalize them, because they've segmented them all out into different disciplines and efforts. They have a SIP program, a HOP thing, a total worker health thing, a mental health thing. So that's really of the type of effort you're describing. I'd be happy to explore that more offline, but I think there are others doing this, particularly internationally, that I'd like to engage with and not do just the domestic version of something if we can avoid it. But knowing
there's a lot of models.
that tends to be a complicated challenge for sure.
Yes. Yeah. Okay. Well, we'll talk more about that. And anyone else who's interested, we can put you in contact with the group that we're working with. We're trying to reach out to, all the other groups, including AIHA, and of course with you, John. That would be great.
Yep. And I think from a society perspective, obviously we want to be engaged there too, and that's my primary focus here. Anything else is just lucky happenstance that will help the society. So not intended to be anything about my personal organization so much as I really want the society to be involved in moving this conversation forward, and it's where we need to be. So love that.
Great.
Any other comments or thoughts from the group that they'd like to raise before I move on to our next segment? Okay, well, I will re-screen share here. Just one moment while I do that. Apologies. Okay, so I know we've probably talked this a little bit to death, perhaps, but just in the interest of talking about where we can go from here and how we can action some of these things we've been talking about here today. I've spent a lot of time in the past 20 years in various guises and hats trying to do some of this messaging work and get this across. And my takeaway from all of that is that I think our voice can be most effective, and we can be most effective as a society when our members do the talking for us and make it real. Because a letter from a society goes on a pile of 200 other letters from other societies. A person who has a job in a district that a stakeholder, that is a stakeholder of a politician, has, even with that small amount of leverage, sometimes more impact showing up to a local committee hearing or writing a letter personally to that person or making a phone call to that staffer than the society or the association has, just because of the way relationships tend to work and potentially politics tend to work. So I think that for us, the broad brush here is that we can be leveraging a lot of different avenues, not just the ones that are traditional. And I think as our members you all are so leaned in, with our membership. I think we're a small but mighty group. And one of the defining characteristics that we have is that people who are members of the society really, really, truly care about this issue with a lot of passion and are willing to go after what it takes to move it. So I think we can do a lot there. I think in order for that to be effective for all of us, the board and the society in general probably needs to set some priorities for you all and to help you do this. And so, we've already talked quite a bit about NIOSH. I think, the budget picture is an evergreen issue. Other public comment periods on bills or requests from information that might come from NIOSH, another great way to offer up our voice. OSHA also puts those out all the time. So any connections you have, I think we've only scraped the surface and we don't even know where our members have all these connections. So I'd love to spend some time in the rest of this year learning where you have those connections as we speak with you, taking on your suggestions for advocacy and conversations and people we should talk to. And in the meantime, I would just say certainly reach out directly to any of the board members on this call. We're happy to explore things, federal, state, and otherwise. And we know you need more. We know you can't just go out and turn that off and bring opportunities to us. So, I think for us to focus from here, thinking about the lanes here that I've listed may be a helpful way to do this. We have a major lane on the federal side, and that's the big picture issues, appropriations, oversight, agencies, core function activity, regulations. At a state level, we can get much more targeted on issues that we care about, and it's easy to get sunk into a morass there. So I think we need to be very careful about how we would spread ourselves. But there are certainly places where we could have a bigger voice and where we could find opportunities to grow our visibility, for instance, by showing up in Washington State to make a comment on their PTSD and workers' comp, mental health bill, right? And then everybody who's there suddenly knows there's such a thing as a Society for Total Worker Health, and they would have had no way of knowing that before. So these are the sorts of lanes we can take at the state level. And then the coalition and partnership piece was mentioned, and there are obviously many, many entities we can do this with, both with NIOSH and other agencies, with the Coalition for Workplace EHS, with some of these other activities that are taking place. And the more we can come in with a crisp and clear understanding of what we want to see as a society and what we want and what we don't want, what we care to engage in, what we don't, the easier it will be for us to actually enact those ones that do make sense and not get lost in constantly triaging everything. So in my experience, what's helped membership groups with this in the past is things like I've listed below. Those are just examples, not things we'll necessarily produce, but that I could very easily turn around for us if we'd like. Letter templates to legislators. Here's our core issue. Fill in the blank of what you want to say personally. Call scripts or little email scripts that you can paste in to things. Alerts when there's a sign on or an RFI that you could have a word in. But we'd love to hear from you. You all are engaged in these things in various different places. Sometimes you work within the entity. Sometimes you're at an organization that's granted funds by that entity, and you're not always able to say some of these things publicly. So I think it becomes a question of which audience segments we have internally, which are internal agency facing, which are industry partners, which are other parts of that ecosystem, and do some strategy around it. So these are, again, I think things that as a society that, they may take a year or more for us to shape. But if we don't start the conversation, we will never get there. So as we're spending this time thinking about advocacy and where we've been and what the landscape looks like, it felt like a natural time to sort of self-reflect and see where we wanted to go. So that's kind of all I have in this segment. I don't know if any of the rest of the board have any thoughts they'd like to share, or anyone has any comments. But at the end, the questions here: what else would help? How would you like to engage? Are there things we're not doing that we could be? Open floor for any feedback or commentary. And this is certainly one you can take back and noodle on. I don't expect a lot of quick hit responses on potentially complex GA issues and advocacy. But I'd say just give this one some thought. Keep it front of mind as you're having conversations. The society should be working for you as a member. And it's our job to hear more from you first and foremost to make sure we get that. And I know we have lots of plans on that for later this year. Apologies if we're being obnoxious sometimes in the year ahead for asking for you to engage more, but know that it's in the interest of making sure we hear your voice, you have that platform, and we can advocate for you. Other thoughts or comments on this? All right. Well, hearing not many, and Serena, yeah, definitely the listening sessions coming up are a great. I want to really thank Serena for putting those forward. Those are going to be great opportunities for you all to share just open feedback on what you'd like to see from the society, what's working, what's not, what you wish we would do, what you might dream up for us in the future, what you'd love to see at an event, a webinar, where we should be placing our voice. Those are all open for your discussion. So please sign up for one of those. Would love to have you there. I know we've got some great questions for you to think about. And if you can't make one of them, feel free to email any of us, shoot us a note, call us up. We want to hear from you, and we want to be your servants as board members. To that end, any other open questions, answers? Doesn't need to be related to advocacy, GA, or any other direct policy pieces. Anything you'd like to hear about, have a question about, would like us to consider as a society, as a board? Happy to open the floor. Well, I know as we discussed earlier, it's been an intense year. I don't think January has really changed that calendar flipping over, and it's been 6 weeks, 7 weeks of 2026 for a lot of us already, pretty fully in that pipeline. So I do appreciate you all spending an hour out of your day, even if we maybe we're a little shorter than the hour and a half. I think that's totally fine. We have a lot to accomplish every day, taking care of the people that we're responsible for. And I think this is really just a reminder to you all that we're there to not only have your back as members of the society, but we want to do more and make sure that we are putting wind behind you when you're out there every day. Because that's what societies like this exist for at the end of the day, not just learning, education, and practicality, but for networking and support, and to have a place that understands you and your voice and gives you the support that you need. So more and more we will, serve that function for you, and expect to hear from myself and Serena and Heidi and Lindsay and others more than ever, and David too. And we're proud to be your board and do this work for you, and know that anything you'd like to ask of us, our doors open and our ears are open. So Heidi, anything you'd like to share here before we close out?
I do have some closing comments, but back to if there's an open forum, I'm really interested to hear what conferences folks are going to and where they're going to be talking about total worker health. I mean, I think that's it's an interesting space. So the different professional environments we find ourselves in. So I'd love to hear from folks, whether it's now or another time.
I mean, I can get the ball rolling for you, Heidi, because I'll be out. I mean, and I'll be out at AOHC representing for the society. That'll be in April, so that'll be one of the first places I'll have to share that. This year, I'm planning to be at the many major conferences that take place. So AIHA's Connect event in May, which I think is a great opportunity, and there'll be a lot of total worker health adjacent conversation there. ASSP's conference, obviously, NSC's conference in the summer and spring. And then the new combined Safety on the Edge / Safety Summit taking place in Baltimore in the spring as well. So lots of big tent events where total worker health will probably be a small part of the agenda, but I think it's our job to submit to those and get that out there. So I think there's more we can be doing as a society there for sure, Heidi. So those are the big ones. I'm also there are a few smaller ones, and I think that's sometimes where our niche might be, is less in that sea of the big conferences and more in the targeted places. And I'm particularly interested in whether we have some ability to speak to, for instance, the HR audience in a more direct way, or the medical audience in a more direct way, beyond AOCH and AOHC and AOCEM. I think there's some potential opportunities for us with psychiatry and other domains, and psychology and other domains, and just kind of go from there.
Yeah, thanks, John. Thanks for sharing that. And I see a lot of folks have mentioned where they're going to be in the chat. And it's even nice to know if we know who's going out where. Maybe we can connect and just maybe talk about the society, or just partner on other types of activities of like-mindedness.
Yep.
Looks like we have some hands.
Yeah, we got a couple hands. Abdulrazak, go ahead, and then David.
Okay. Yeah, hi. Good afternoon, John. Good afternoon, John. Good afternoon, Heidi, and everyone. Thank you all very much for all you're doing for the profession, and that's for safety and occupational health and total worker health in general. So, I just want I'm a clinical associate professor at Indiana University in the safety program. And I just want to say first, I've been teaching total worker health pretty much, I think, for the last like 4 or 5 years. Like it was something I introduced when I was back at Kent State College. And when I came back to Indiana University last fall, I started doing that as well. So I'll be speaking tomorrow actually at the Indiana Safety and Health Conference on mental health and well-being among safety professionals. So taking care of the caretakers, and I introduced total worker health principles into that as part of like the solution. So safety and occupational health professionals, they go through a lot of unique mental health challenges, and no one really cares about them. It's mostly, or even they themselves don't care about themselves. And I feel like total worker health is a very good way to get safety professionals to, first of all, be aware of these things yourself, and also be able to, preach that message further out. So I have a diagram of the total worker health hierarchy of controls for what to do. So that's part of my presentation, and I'll also be at the my proposal to speak was also accepted at the National ASSP conference in California. So I'll also be speaking on a similar topic. Same, also mental health and well-being among safety professionals, and total work health is going to feature prominently in there as well too.
That's awesome. And I love that story and just how you came into total worker health and how you did that whole everything there was a really warmed my heart, and I think shows the power of what we do here and what we can do to help you on that. If it's a couple of messaging slides, if it's anything we can do to support the presentation or talk to folks or promote it, from our LinkedIn account. These are all things that I think the society would love to do for members who are out there talking about this. And where we can't formally as a society, we can certainly put some lift under our members who are. So please feel free to
Awesome.
share more details with us, and we'll do some things there.
Thank you. Thank you very much.
Love it. David.
Yeah, hi everyone. David Shapiro again, Colorado School of Public Health, treasurer of the society. I just put it in chat. An interesting one
Yeah.
for those of us in total worker health to consider is the first national summit of opioid settlement funds. The National Opioid Settlement Conference will be in Denver in June, June 17th to 19th. So this will be states that receive opioid settlement funds, and I'll be hosting a conversation on recovery-friendly workplace, supporting individuals in recovery and substance use disorder in the workplace with the first state to have a recovery-friendly workplace program, which is my friend Sam Lewandowski from New Hampshire, and our other friend Tyler Minock, who works for Hamilton County in the Cincinnati, Ohio area. And so I don't know how much occupational safety and health will be at this conference, but with it being the first one, and with the idea that this will be a conference that continues probably for the next 2 decades, which is what most opioid settlement funds are going towards, it's probably a good idea to start having more representation on worker health and safety at something like the National Opioid Settlement Conference. So I just wanted to mention that one to everybody. Plus, it's in Denver, so would love to see anybody that wants to come to my neck of the woods. So.
No, I love that one too, David. And I think a couple things there. Just as I said with the Duazak, we should be thinking as a society how we can, collate and share that out and make sure that's visible and get industry seeing it and support your efforts as a speaker with a society message as well, if that helps. And then more generally, I think being closer to the recovery space is a very important thing for us. And I think that, and Claire, this goes back to many conversations you and I had back in the day at good old NSC. I think that there's a huge bridge we need to build between the OSH and public health and recovery spaces that, we all know and we will preach every day, everybody that's on this call. But so many in industry don't see and don't have the ability to see because they don't deal with it every day. And so David, let's talk, because I'd love to figure out how we can get more directly engaged there. And I have a lot of friends in that space too, as I know you do.
Sounds good.
Thanks for the great discussion, folks. I mean, there's so many things that we can uncover when we're all sat together, and definitely want the society over the next several years to continue to give you more of these opportunities. And I see the momentum growing as much as it's frustrating to be having some of these conversations again 10, 15 years after we sort of launched them and had a bunch of energy around them, I do see the cycle coming back. I see, a lot of industry leaders interested and materially affected by these things in a way that's it's much easier to get the message across than it was 15 years ago. Because the world has played out in a way where it's become more obvious to everyone. And so that's frustrating and a struggle for us from an impact side, but I think it makes the messaging a little bit easier at this stage when we give it another go. So our ears will continue to be open, so feel free to keep sharing these things along. And as Serena goes out and chats with a lot of you, I'm sure she'll be picking up a lot of pieces. So again, we'll give you back a half hour in your day, I think, from the timing we were expecting. But Lindsay, anything else we needed from a closeout next steps side or?
No, I don't think so. I know Serena put some information about our listening sessions in the chat that will be happening in March. So I want to encourage everybody to attend those. And then you will see another member event in April with more information being released on that here in the next couple of weeks. But past that, I want to thank everybody for attending. And I hope you all have a fabulous rest of your day.
Thanks, Lindsay, and thanks again to Heidi and for all of you who contributed and took part. And we'll be seeing you again soon. Bye, everyone.